So, good morning, everybody, and I can assure you we were hoping we were going to be back here the next day, and as things get better, we're trying to do less of the press conferences, but there's some important information I got to put out about the federal government, but unfortunately today, after I guess you got to choose your words wisely sometimes, of having 0 cases yesterday, we went up 16 in the last 24 hours. So we've said this before, it's like a roller coaster. We go up, we go down, and we were hoping over the last 2 weeks or 3 weeks, and it's been actually 4 weeks since the Hudson Ave party, that this wasn't going to happen again. But as of today, there's 2,474 positive cases of the coronavirus in Albany County, 499 people under mandatory quarantine, to increase of 16 positive cases since yesterday. Among the new positive cases, we know 2 are healthcare workers, 7 have close contact to a positive case, and 1 had reported travel out of the state, and 6 other people they're still working on for a clear source of infection. 9,263 people have now completed quarantine. Out of those, 2,443 tested positive for the virus and have recovered. That's an increase of 7 recoveries. There are now 9 people hospitalized. We went up 1 hospitalization from yesterday. So we have 9 people in the hospital as of today, and the hospitalization rate being 0.36%. Yesterday it was 0.32%. So we have 1 patient currently in the ICU, and yesterday the number was 1 person too. But as you know, when we're on these control meetings, which actually we went down to 2 days a week and sometimes 3, but mainly 2 now, we look at the hospitalization rate. And General Murphy brings it up all the time, and Rubito, and they talk about the hospitalization and how it's affecting us going forward. So this is the highest we've probably been in a while, at 9 people in the hospital, but we got to continue to watch that. Over the last 5 days, there's been an average of 4.8 new positive cases. Yesterday, it was 3.2. If you have any concerns with the virus or you want to get tested, please, you don't need signs or symptoms, go to UAlbany, as always, 1-888-364-3065. Our mobile testing site with the partnership with Whitney Young, as always, 518-465-4771. RiteAid.com on Central Avenue and 155. Please go there if you want to. And then again, remember just 4 basic things: wear your mask, cough into your arm, clean your hands, and stay 6 feet apart. We'll continue to get through this. We've worked diligently to protect our most valuable residents at our nursing home since this began. I shut the nursing home down first before the governor did. I know it's been tough for families with loved ones. I know it's been tough for the workers out there that you can't go physically. You can see them from the windows, but you can't physically touch your loved one. And I know the rule that the governor said every time someone comes back positive, it's 28 days until you can have someone open up your nursing home. I don't think there's a nursing home yet that has opened up because of that policy, but I'll stand corrected if one has. It's been tough. Our workers had to get tested every 2 days, twice a week, and we brought that up to the control room and we knocked it down to 1 day a week, which was good. And the other problem that we've had, that when we knocked it down to 1 day a week, testing comes back 6 to 10 days. Now think about that. You're testing on a Monday or a Thursday. Tests are coming back slower because, believe it or not, nursing homes are a priority as essential workers like hospitals and stuff like that, so they don't come back quicker, so they get put back on the back burner. So we can literally take 3 tests before you get the first test back. So it makes no sense that you're doing all this testing, because by the time you find out if they are infected, they've already been, it takes 14 days or 10 days. It was taking on average 7 to 10 days more than 10 days of getting our test results back. So, just figure it out. So it really made no sense. But that's what we have to deal with, and we had to find solutions to the problems. But, when this all started, I want to say that, working in partnership with our nursing home and surrounding nursing homes and the Department of Health, we kept reaching out, and now the federal government, we were on a phone call yesterday at 16:30 with the feds, and basically they are now mandating, as Governor Cuomo has done first and foremost in this nation, I believe, taking the governor's leadership, and they're going to make mandatory testing for all nursing homes for all their employees 1 day a week. But the difference is that the office, and it's getting done. We had the briefing yesterday from the Office of the Assistant Secretary of Health, and authorized by the U.S. Food and Drug Administration, FDA. So this is important for many reasons. The testing kits and nasal tests that will be getting done at Shaker Place, they are now providing us a machine so we can test in-house. Testing kit for one employee takes less than 15 minutes to turn around, so we can test them, and we'll know within 15 to 30 minutes, depending on the logistics, of if they're positive or negative. And what's that mean? It means that when we have workers show up and we test them, we're not waiting 10 days. So I do want to give a huge shout out to the federal government for providing this. We're one of the first counties in the state of New York to receive this, that are going to be receiving the machines. Eventually they'll go out to all the nursing homes, but I think there's like two or three that got selected now in the state, and then eventually we'll put out, and they're going to give us the testing kits. What's that also mean? Money. And I hate to say that, we're spending over $16,000 a week testing employees. I mean, it's been a huge financial drain, not just on our nursing home, but also on hospitals and their nursing homes and their staff. So by us being able to give the test in-house, we don't have to administer it. We don't have to, we do administrate our own tests. We have our personnel that are trained to do this, and they'll do it in-house. We'll have the machine to test in-house. That means we cut out the middle person, and we're going to save tax dollars, which makes sense going forward. So roughly we should be saving, now that we can do 100% of the test in-house, we should save upwards of $10,000 a week, hopefully more eventually over time. So that's a big savings, and it's big news. And what it also means, when we have patients that have to go out for care, we can get them tested before they go out and have that results before they get to the hospital. And when people are coming back, and we need to get them tested before we put them out into, into open areas with other people. So it's going to protect our residents that are that we're caring for, and it's going to protect our workers. So it is pretty big news, and again, it will help with, eventually we can probably start doing more workers in the county as we open up and start bringing people back. Eventually, if that ever happens, because we're still not at 100% staffing levels. And as we get prepared for October, for the flu season, and we're getting prepared for a second wave if it happens, we have more tools in the arsenal to protect the workers and to protect the residents and do it in a safe manner. So I do want to say to the federal government, thank you. I'm glad that we're the first receiver of these machines. It's going to make a difference in the life of our workers, obviously, and it's going to give us accurate snapshots right away. Not waiting 10 days and saying, oh, well, it's been 10 days, so at this point, or getting getting the test back and then literally getting the next test from a week ago after it. So it's going to be useful, and it's going to help us going forward. But again, thank you to Larry Slacky and the nursing home people out there that went after this, and again to the federal government finally doing what the governor of this great state of New York's been doing, and now making it mandatory across this country to be tested once a week, but also providing, I want to say thank you to the federal for providing the equipment to do the testing, so it's not going to cost us that much more going forward. Dr. Whalen.
Thank you, County Executive McCoy. From our perspective, we continue to monitor the cases as they come in. Yesterday was definitely a bit of a blip, but sometimes we find that this can occur. There is, when we get a lot of cases on Tuesday and no cases on Monday, we're cautious of the fact that the reporting may have been delayed, and we're diligently doing case investigations to determine if that's the case. But as always, we are identifying all close contacts, making sure that people are isolated as appropriate, and those close contacts are quarantined. We continue to advocate for testing with the changes that we're looking at in the county in the next couple of weeks with the resumption of school and universities. It's going to be very important that we continue the messages around the important behaviors that can prevent COVID spread. And, you know, we look forward to working with our school and university communities going forward.
Thank you, Dr. Whalen. And again, that's one of the bigger questions we continue to get from parents with kids going back to school very shortly. It's going to be September 1st, believe it or not, around the corner. I believe we're getting into 166 days today since our first case, somewhere in that neighborhood. But we are doing our due diligence, and we are working with the superintendents in the schools, and trust me, they're doing the same thing, the superintendents and principals and teachers. We're there to protect the teachers too, and to make sure that they're protected and how we're going to do this going forward. Again, you know, we got to try it. We got to continue to open up and move forward, and hopefully don't have a setback, and don't have a setback in October. But as always, please, to everyone out there, you know, that needs mental health support, it's available 7 days a week, 8 a.m. to 5 p.m. And the number, as always, is 518-269-6634. And our 24-hour sexual assault hotline number, 518-447-7716, and the New York State hotline. And to everyone out there that has issues, please, you know, that's what these lines have been established for. Reach out to them, and we want to be there to help you and continue to do the right thing. We'll continue to move forward, and trust lies in us when we say this to all the parents out there, because we are parents. You know, we want to do everything to protect you, but we also need you to do the right thing to protect your kids and your loved ones, again, by wearing your mask and doing everything the right way. Thank you.